Any way to help these puffy eyes? I am a 40-year-old woman. For years I've struggled with puffy eyes, especially the left side. It used to come and go, but now it seems constant. The under eye area swells under both eyes, and the upper eyelid swells on the left side. I'm assuming it's water retention. All allergy tests came back negative. I don't eat much sodium. Are there any surgical fixes for this? Or anything at all that could help? It's gotten so that I look old and exhausted all the time, and I really avoid photos.
Thank you for your question. You submitted a photo and you state that you're 40 years old and that you have been dealing with under eye bags and periods of swelling that you feel are related to water retention. You underwent allergy testing, which came back negative, and you're looking for possibly a surgical solution. And you have the typical questions that most people have when they are frustrated with under eye bags. So I'm going to offer you some idea of how I approach situations like yours in my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Under eye bags and eye rejuvenation is one of the most common procedures that we do in our practice, with a wide range of solutions, and certainly your situation is extremely common. So first I'll give you some idea of understanding the situation with the bags under your eyes as it appears in your photos. The puffiness under your eyes that you feel always makes you look tired represents something called lower eyelid fat prolapse. Lower eyelid fat prolapse means that the fat that's normally around your eyes pushes forward and actually creates a bulge. And that bulge is subject to variability of water or fluid in this area. So allergies, sinus problems, salt intake, and depending on individual hormonal fluctuations, have some degree of affecting the expression of the level of puffiness. However, the underlying most significant anatomic issue is fat pockets. And this is why very commonly people first try over-the-counter creams and miracle solutions which don't work, because frankly these fat pockets are much too large to be dealt with under-eye creams. So there are basically two options when someone has under-eye bags these days. If it's slight under-eye bags, then we can actually soften their appearance by creating volume in the valley, in the area known as the tear trough, using a filler such as Restylane or Juvederm. In your situation, just from the photos alone, I suspect you might not benefit as much with that less definitive procedure, which is to put the filler. The more definitive procedure, which I would typically do for someone like yourself, would be a procedure called a transconjunctival blepharoplasty. Transconjunctival blepharoplasty is a surgical procedure where the fat pockets are addressed from the inside of the eyelid. And what we do is we reduce them as well as reposition them and reshape them. And the point of doing that is to address the contour so that the under eye area has a more natural continuity and you don't have the bags under your eyes. Now, this is a highly successful procedure and works very well, and in addition, we commonly combine this procedure to help the skin quality with something like platelet-rich plasma as well as laser. Platelet-rich plasma is a concentration of the growth factors and the wound healing factors from your own blood that stimulates your collagen. People are becoming more and more aware of this PRP, or platelet-rich plasma, and it does a nice job of helping skin quality at the same time of doing this procedure. Now, this procedure in our office is typically done under local anesthesia with light sedation. This means you avoid general anesthesia, you avoid having to go to a hospital or surgery center. In our office, we have these facilities that are certified by the Joint Commission so that we meet the same standards of safety like a hospital and provide the convenience of an in-office setting. This is something that I think would most likely help you. Now, beyond that, I still advise my patients that if you have allergies, manage the allergies. Now, I know you went through allergy testing, but if seasonal allergies or pollen, trees, grasses, other things that cause allergies should be optimally managed. If it's a sinus issue, manage the sinus issue. You have to become kind of aware of what are the things that cause the area around the eyes to swell. You state that your upper lid also swells. So there may be some other issues underlying. If there is any question, you should at least see an ophthalmologist, get a proper eye exam, maybe see your medical doctor or endocrinologist just to rule out any other issues that could be aggravating the situation. But generally speaking, this is fairly straightforward, and as long as there are no other medical issues concurrently, this is a procedure that people come in and go back to work in less than a week. So I think it's important that you now look for qualified, experienced cosmetic surgeons and learn about your options. There are different ways to approach this problem, but I'll tell you from my perspective, this is the least traumatic, most expeditious approach, where local anesthesia, light sedation, address the fat pockets, go back to work in less than a week, looking considerably better, and then having this nice long-term solution has been very successful in a career that's over 20 years. So again, meet with a doctor that you feel comfortable with, who will give you some guidance, show you some before and after pictures so that you understand what their aesthetic style is, and then move forward. So I hope that was helpful. I wish you the best of luck. Thank you for your question.